Hello and welcome to Seven Sentinels. This is Grandmaster class and I am Peter Simon with you. Today we are doing speaking sessions and we have now with us Dr. Noor Alam from Maldives, originally from Bangladesh. Yeah, Dr. Noor Alam. Are you ready?
Yes, sir, ready.
So you have 3 minutes to prepare and you make your notes. This card is here, the doctor's card. You have 3 minutes. Once 3 minutes finish, then you can start the speaking session. I will not tell you anything. You can directly start over and I'm waiting for you here. And you can ask me any doubts if you have within these 3 minutes also before you start.
Okay.
Your preparation time starts now.
Good afternoon. I am Dr. Noor, medical officer from this hospital. Thanks for coming to see me. How can I help you?
Doctor, I want some assurance from you, doctor, because I don't know what the hospital found and what it is. I'm a little bit confused and puzzled. Can you please explain me and give me the necessary suggestions, doctor?
Okay, sure. I got your report. But before that, do you mind if I ask you any past medical history?
Definitely, doctor. I am ready to give you whatever information you want. Please ask, doctor.
Could you please tell me what is your complaint and what are the difficulties are you facing?
Actually, doctor, I am an aged person and I was recently hospitalized following an acute episode of pain in the lower left abdomen. And in addition to that, I had some rectal bleeding due to diverticulitis. I have a long history of constipation, doctor. I don't know why.
Okay, based on your history and the hospital report, it seems that there is a case of diverticulitis. So it is the infection of the large intestine where there are some pocket-like spaces which are caused because of infection and so many other causes. And at present, there is no signs of complication as there is no perforation, no abscess, and no other complication. So it is recommended some medical treatment to continue your improvement.
Okay, doctor, that's the point actually. On discharge, I was told to consult you and was given no further information regarding the diagnosis or the future prospects. I am really worried about this condition. Doctor, will this condition recur or again and again? And I have heard of people dying from this problem. I don't know what to do. Doctor, I want some more information regarding this.
Okay, I appreciate your concern and sorry because you have not received enough information as you mentioned. So extremely sorry for that. So just now I want to share you that this is a case of diverticulosis, and in these cases there is no complication right now for you, and it is recommended medical treatment for you, which will be very helpful, and some dietary modification also is advised to avoid constipation because constipation is the one of the risk factor, and old age is also the one of the risk factor which causes the pouching that is called ultimately diverticulitis. So in these cases, bacterial infection and some other infection also inviting and causes this situation, this diverticulosis more complicated. So it is recommended to continue the laxative medications, but it is important also to remember to avoid the excessive use of purgatives because sometimes it causes diarrhea. So it is also not expected result. And I want to mention that at present, no further investigation is necessary, but colonoscopy is recommended in the further step to evaluate the further condition. And it is also important to remember, and if there is any rectal bleeding or any very severe abdominal pain, it is always very important to consult as soon as possible to evaluate your condition.
Yes, doctor. I want to know if I am likely to have another episode in the future.
Yes, it is very common. There is a high chance of recurrence. As I mentioned earlier, there is because of weakness in the large gut, I mean the large intestine, it occurs. So the gut is mostly if it is infected due to bacteria or any other causes or any gut movement is slow, if there is stasis of the food, this infection is recurrence rate is too high. So it is always important obs- uh, to monitor your sign and symptoms to avoid any complication. And for the time being now, antibiotic treatment is recommended to control the disease and to get better situation.
Fine, doctor. I want some advice on controlling the condition and preventing recurrence. Give me more details, doctor, so that I can be, very well maintaining the condition.
Yes, especially for your the lifestyle should be changed. Exercise is also recommended, which will be very helpful to for the bowel movement to avoid the stasis of the food and the increase high fiber diet, which is also very helpful for the gut clearance and for, healthy food and too much painkiller. NSAIDs should be avoided because NSAIDs also causes some injury to the gut and making some ulceration, weakness and scarring and some abscess also in the long run it causes. So it is always advisable to avoid these things and moreover smoking also should be avoided. And one more important thing, if there is any bleeding per rectum and severe abdominal pain, it is always recommended to consult as soon as possible.
Okay, doctor, that's very fine. I want you to explain why the hospital gave me these antibiotics. Are they really necessary?
Yes, of course, it is really necessary, as I have mentioned earlier also, that this is mostly because of bacterial infection. So if it is not provided with appropriate antibiotic, the infection will cause some other complications. For example, abscess, scarring in the gut, and then obstruction, and then fistula, which ultimately causes peritonitis. In that case, it is a medical emergency. It is not expected. So it is always advisable to avoid these complications. Antibiotic is the first and prime treatment should be taken and should be advisable in this condition.
I am not very much convinced. It's not so easy. I don't think this is going to work out. It was a very frightening experience. Okay, I'm not very, but I want to listen to your advice and I'll try to follow you. But I'm
Oh,
not very much convinced, doctor.
okay, just I want to recap as it is inflammation of the diverticulitis. That means this is the infection and inflammation of the gut which is caused by the weak part of the intestine and where the infection persists because of the bacterial infections mostly. So it is in the gut. We can't see, we can't even touch. So it is recommended to resolve the infection as soon as possible. So antibiotic is the only way we can initiate as soon as possible to avoid any further steps. Like if there is any peritonitis or any scarring, there will be a very high chance of medical emergency or surgical intervention. So it is always expected to take preventive measure as soon as possible to avoid any surgical intervention or any medical complication. So for this purpose, this antibiotic is recommended and the other advice like dietary modification, lifestyle and high calorie diet to use laxatives in a proper way is recommended. So I hope it will be very good for you and to avoid any further complications. And moreover, colonoscopy is also in our plan. 6 monthly or it should be done. And gastroenterologist consultation also can be done.
Okay, thank you very much, doctor, for all the suggestions. I'm a little bit convinced now. Thank you. I'll follow all your suggestions.
Is there anything else I can help you with?
That's very clear, doctor. Thank you for your kindness and patience.
Okay, you are welcome.
Right. Now let me give you feedback, doctor, regarding this session. First and foremost thing is the first and foremost thing are unnecessary sounds which have to be avoided on an emergency basis. I should not hear again. So better prepare and speak practice, improve practice on a normal basis. Try to take a reading task and go on reading loudly without any pauses and breaks. The continuity, the flow of speech is very important for you. Then there is no signs of, there is no signs of is wrong. There are no signs of, there are no signs of. Otherwise, there you can say there is no sign of. Singular sign means is, plural signs means are. So pauses and breaks are there, which you have to avoid. Then you are using the word so multiple times. So repeating this so is necessary and it is warranted. The sooner the better. Actually, it's better to avoid the word so totally because it's a habit for you. So whatever habits and mannerisms are there, you have to avoid because it is negative. Next one, monitor your sign and symptoms. You said monitor your sign and symptoms. Monitor your signs and symptoms. Okay. Then where the infection persists, where the infection persists, infection persists or infections persist. You have to add S here or there, any one place. Okay, where the infection, if it is singular, you have to add persists. If infections plural, then you have to say persist without S. So this is a mistake. The next one, there are a lot of repetitions. You said medical emergency and surgical interventions. Then you repeated that again. You repeated. Okay. Second time you used it. So avoid a repetition as far as possible. Then next one. Yeah. So coming to the point, introduction. The introduction was very good, but not extraordinary. You could have definitely said in the introduction like this, welcome and please be seated. I am your doctor, okay. I'm your treating doctor or the doctor on duty in this suburban clinic. I see that you are a little worried or upset, and I want to know what is bothering you. Can you please tell me how I can help you, or can you please inform me? Can you please provide me the details of your visit? What is the purpose of your visit to this clinic? This is the way how you have to speak. And then next one, what you have to do is confidence level. Your confidence level is very high. That's very good, really excellent. I appreciate your level of confidence. And then the grammar mistakes are there. Errors here and there, you have grammar mistakes. So you have to improve in that grammar accuracy. Then vocabulary. Vocabulary, you can learn C1, C2 vocabulary and try to use them in your own sentences. Try to point out, write those words, and whenever possible, you try to make sentences using them and try to use those sentences in your speaking. Your health and well-being is our primary responsibility. This is one sentence you can use in every speaking session.
Okay.
This is a common problem occurring in many individuals, but with a constant perseverance, but with perseverance and dedication or medication compliance and obliging to the demands, obliging to the recommendations given by the medical authorities, if you implement the suggestions on a regular basis, definitely you can overcome this problem. This is the way how you can speak. So vocabulary you can improve definitely. Then pronunciation part, yeah, you have to bother about this pronunciation part a little because we are not a native speakers, and definitely we are non-native speakers, and our pronunciation will never be at par, but at least you can try to improve your quality. You can come somewhere in the middle of the balance. You need not be excellent, but you need not stand where you are. You can improve in the long run. Maybe within 1.5 months, 2 months, you can definitely get excellent pronunciation patterns. What you can do is you can take the audio script, audios, and you can keep the audio script in front of you and read the words along with the audio, 1 word or 2 words, how many words you can. Sometimes if you cannot, okay, then afterwards again you can start, let the audio be running. Wherever you can catch and wherever you can go, you go on reading, whether you can follow him or not. You go on reading, but try to match his speed and his fluency and his pace. And his pronunciation matters the most. So try to implement this. Then sentence structures. So I understand that you are not comfortable or convinced with my opinion, but rather than pleasing you, giving you upright information, giving you utmost necessary information is my responsibility. Maybe it hurts you or it bothers you, but as a doctor who is responsible for your health and well-being, it is my fundamental, or it's my first and foremost responsibility to give you accurate information regarding your present condition, the causes which resulted in the development of the present condition, and the symptoms that you have, in addition to the treatment modalities that ought to be provided for you for the speedy recovery. So this is the way how you can create your sentences. Add 1, 2, 3 sentences and make a bigger sentence, and make a simple, complex, compound sentences. If you can't make biggest sentences, no problem. You can make 2 sentences and join those 2 sentences. If you follow my you have to follow my recommendations, and you will improve. Okay, you will see signs of improvement sooner the better. So that's these 2 sentences. If you join, if the recommendations are implemented, the recovery will be earlier than expected. If the recommendations are implemented, the recovery will be sooner than expected. See, 2 sentences joined with the word if. Okay, like this you can make better sentences. Then next you can say accuracy. Accuracy is in 3 forms. One is vocabulary, the words which you are using, the sentences which you are speaking, the grammar which you are using, and the pronunciation, how you are speaking. So all these 3 things, the vocabulary in the sentence, the grammar in the sentence, and the pronunciation when you are speaking. All these 3 added to your accuracy. Then fluency. Fluency is the flow of speech, word after word, without any without any pauses and breaks. So the continuity of speech is called fluency. It can be fast, it can be slow, it can be moderate. No problem at all. But the thing is, the words should flow word after word, word after word, word after word, without any disruption or block. So that is called fluency. Then passive voice. You are using passive voice, but you are using maximum 20 to 25% only. The rest of them are active voice sentences. So try to flaunt active voice, flaunt passive voice rather than active voice, because active voice, more than active voice, passive voice is recommended. The reason, on the grounds of what? On the grounds of those things. The first one is you are not important, so remove yourself. This is called emancipation of yourself from the speech. Okay, you should not think that you are a doctor like that and you are great like that, and don't focus on yourself. Focus on the patient, and more on the than the patient, focus on the thing particularly which you are speaking. For every sentence has its own newly introduced topics that make it the subject of the sentence. For example, if you are talking about medication, start with medication. If you are talking about surgery, talk about surgery. For example, medical emergency and surgical interventions are necessary in case of complications. Avoiding such complications is recommended. Implementing the suggestions is advised. Timely consumption of dietary regimen, timely consumption of meals is suggested. So like this, you have to use what is the important. Then what else you can say here in this part? Yeah, worrying will not lead to worrying will trouble you. So relaxing is important. Understanding the situation and acting according to the demands is advised. So try to use passive sentences as far as possible. Afterwards, you can go to the video on YouTube and you can take it and you can write these sentences which I am telling you, because I cannot write them and give you. I have already spoken, and you can note them down and you can use these sentences in every speaking session in one way or the other way. You can modify that. The sentence styles are same, but the structure may be different. The words may be different. The style may be different, but the speaking session the techniques are the same. So passive voice, vocabulary, C1, C2, all these things are one and the same. Next one is flow of thought, idea generation. Actually, you have a lot of materials. You can think which is the most important, which is the least important, and which is semi-important. So relevant material, irrelevant material, and semi-relevant material. So what is more important? You have to identify and you have to pick and choose. And more relevant material you must use, semi-relevant use according to your logic, and irrelevant material ignore and eliminate. That is what I can tell you. This is flow of thought. When you are thinking, you have to think what is the most important, use those things only. Subject knowledge is excellent because of your practice and a lot of experience. I think you have got a lot of subject knowledge and you are well versed with reading and material, lot of information gathering. So that's why you have a lot of subjects. So use the subject and flaunt it to improve your scores. Reassurance. So you have to make the patient convinced. He should be saying, very, doctor is excellent, outstanding, like that. You should not agree with everything, but you have to reassure in a proper style. How are you going to reassure? I'm going to give you one sentence, one set of answers here for reassurance. Diverticulitis is a problem in reality, of course, of serious dimensions. But to tell you frankly, many people have this problem, and after managing the conditions effectively with implementing the recommendations given by the doctor, they have come out of this difficulty and are able to lead their lives successfully. If all these people are able to manage and cope with this problem, then definitely I believe you can overcome the situation with your effort, patience, and compliance with the recommendations. If I were in your place, I would also have felt in the similar fashion, and I would have been worrying too much and feel the situation where full of panic, worry, tension. But as a nurse, I have an experience. I have a rich experience with a number of patients, number of people who had this problem, and I can vouch safe the testimonies of many people to you. And because of all these things, I can strongly inform you. I can give a strong testimony that this is not a very serious complication if you oblige and follow the suggestions with all your body, mind, and soul. So you can, if I were in your place, I would also worry similarly. So what I suggest you is, my suggestions are to implement the recommendations of the doctor, or however you want to phrase it, rephrase it, everything I'll tell you. Right. The next one, conclusion. Yeah, conclusion also you can give it in a stylish way. You can say like this. Yeah, so according to my knowledge and understanding, I have given you all the relevant information which is required of you. And in case still any doubts persist, you can definitely ask me now, and I'm ready to give you the necessary information to the best of my knowledge. Is there anything that you wish to ask me for? That's how you can conclude. Then overall, it was a good speaking session. The level is B grade, definitely, but you can try for B plus. You can improve still. You can score above 400. This speaking session will give you 370 to 390, but not 400. So, Dr. Noor Alam.
Yes, sir.
Now you have 1 minute to speak about your experience. Okay, how these grandmaster classes are helping you with your speaking sessions, and what are the practice with Kezia sessions, and how you are improving your fluency there, and how you are coming with the grandmaster class and you are taking accuracy part, corrections and feedback and suggestions for improvement. So what are you learning? And this direct live session, did you feel that it is a real session where you are sweating off like in the real examination? Did you feel how was the impact? Are you gaining real knowledge, or you think you are wasting your time? What is your opinion regarding these classes? Would you recommend these classes to your friends? I think you already recommended. So what are the reasons why you feel that these are the best suitable classes for you? You have 1 minute to 2 minutes maximum.
Okay, sir. Actually, it was a very good and effective program that I came to know from one of my colleagues. So after that, I joined, and day by day, I was improving, and still now I'm on working on it with the help of you, and I'm practicing with Miss Kezia Philip. That is very helpful for my fluency and the regular practicing and fashion. And because of this speaking session, it is improving a lot, especially fluency, accuracy, the subject knowledge, and the orientation of the arrangement of the speaking, the way should be introduced, and the conclusion. Everything is in a proper way. So before we are not used to uh, present a case like this, as far as I know, and day by day it is improving, and it is a very good and effective way. So hopefully day by day we will improve a lot with the help of you, and uh, it is a very good and the technique to starting the making a plot and the ending of the session of speaking is too excellent.
Yes, that's fine. Thank you very much. And we'll meet in the next session. Thank you once again.
Okay, sir, you're welcome. See you.